I think most of you are restoring implants, but do you know if they're any good? If I look at that case, there are 3 implants that are standard diameter and 2 small ones. Before restoring that with a removable, how do I know they're ready? Am I trusting the guy who put them in? I doubt it, because they never restore them. All they do is screw the screw in. All you got to do is find the bone and screw it. Can we use something like the Austell beacon, which has been around a long time? I am using that on an implant to support a removable. And if it has a given number, like 70, it says it's stable. I'm going to ask Tim if it's integrated, and he'll tell you. Let's see about this one. That one beats on the implant somewhat and gives you a reading. Tim Palmer, head of science and CR. Tim, tell us, are these any good? Should every dentist have one? If not, which kind of dentist should have one? Go for it.
You bet. Thanks, Gordon. These are good, and they will tell you about the stability of your implant. There's 2 technologies that are prevalent with implant stability testers, but they work on the same principle. All structures that are rigid vibrate with a high frequency, and that's the simple principle that both of these technologies use. One puts a special peg on the implant, and that peg has a small magnet in it, and it's activated with the magnetic pulses, and the resonant frequency is analyzed, and these are called resonant frequency analysis devices, such as the Austell units or the Penguin RFA unit. These are very accurate, and they're well proven in studies. The other technology, like the AnyCheck or the implant test, is to tap gently. These are called impulse testers. They tap gently on the implant and again measure the frequency response of the implant. The higher the frequency, the more stable the implant. Both technologies work. The one that uses the pegs and the resonant frequency analysis are more precise, more consistent because of the calibrated peg. Those that use impulse or tapping technology can be a little more variable, but in both cases, the number gives you an indication of stability.
Tim, do either of these concepts evaluate osseointegration?
No, they don't. These are adjunctive devices. There's really no true way to evaluate osseointegration. However, these add a degree of analytical value to your analysis of the stability of the implant. You use these in addition to x-rays, in addition to physical tapping with the handle of an instrument, your visual inspection, but these give a quantitative analysis which can certainly increase your assurance that the implant is ready for restoration.
Does one concept have advantages over the other concept?
Each has unique advantages. The impulse testers that tap on the implant seem to be more versatile. They can be used on the healing abutment or on any other abutment, even on a temporary restoration on the implant. The other resonant frequency analysis devices, they're more precise and more accurate because you have to unscrew the healing abutment, attach the calibrated peg, and this gives you a very precise reading. So both have their advantages. Now, one question we often get is who should be using these? Frankly, any doctor who's either placing implants or restoring implants would benefit from these devices. Particularly if you're not restoring implants you've placed yourself, they could be highly beneficial. Or if you're just getting into placing implants, they could be very beneficial.
Tim, you and I agree on the value of these instruments, and I think it's time for some of you to look very seriously at them, particularly general dentists who are restoring implants routinely and don't have complete trust in whoever's placing the implant, which is obvious. They don't really restore them. So I would prefer that a dentist places it and restores it. You have to decide, are you questioning the individual who placed the implant somewhat? You never say that. If so, it's time to look seriously at when it is appropriate to load the implant. Thanks for being with us. Join us next week.